This week is World Health Workers Week. It's an opportunity to mobilize communities, partners, and policymakers in support of health workers around the world. Health officials say there is a need to fill in the gaps in the health workforce and ensure that health workers have the training, supplies, and support they need to do their jobs effectively. The United Nations Sustainable Development Goal, the SDGs, number 3, aims to ensure healthy lives and promote well-being for all at all ages by the year 2030. And experts say health workers are key in achieving the SDGs. The World Health Organization estimates that the 4.5 health workers per 1,000 people are needed to achieve universal health coverage. However, the shortage of health workers is growing and is projected to be more than 18 million by 2030. Joining us now from our New York studio is Joy Marini, Global Director, Global Community Impact at Johnson & Johnson. Ms. Marini, welcome to the show.
Thank you.
So give us a sense of what is happening with the health workers. There is a shortage globally. What seems to be the problem?
Well, at Johnson & Johnson, we believe that health is at the heart of human progress. And with good health, children thrive, communities prosper and rise out of poverty, and governments grow their economies. Unfortunately, as you mentioned, we're going to end up with a shortfall of 18 million health workers by 2030. We won't be able to reach the SDGs, or Sustainable Development Goals, without a strong health workforce.
So what are some of the main issues, and how do we address these?
There are many problems. One of the ways that we can address it is to ensure political will. Health workers need to be supported on every front. At Johnson & Johnson, we take a holistic view of this. So we look at getting young people into health careers and interested in science, training clinical skills for health workers. And when that health worker is ready to be a leader in their community and their hospital, helping them with leadership and management tools.
And you mentioned leaders. We see that women are very much a major part of the health workforce. However, when it comes to leadership, we don't see them very much. What is the problem?
Yes, amazingly, out of 7.5 billion people in the world, 5 billion are taken care of by a woman health worker. Yet women health workers only represent less than 25% of the leaders in the healthcare field. Can you believe that women health workers contribute $3 trillion to the global health budgets, and that is 5% of global GDP? But we just don't have women leaders. What we know is that when we have women health leaders, their maternal and newborn mortality drops, people thrive, and communities are healthier.
So whose responsibility it is? Is it for women to access this leadership position? Is it because they do not really think about pushing forward, or the opportunities are not there? Because if they do not seek the opportunities, maybe they will not reach that level.
Well, one of the things we definitely need for women is a more gender-friendly workplace. Okay. We don't have safe spaces in the workplace. We don't have policies for women. We don't push women forward in leadership positions.
So then, moving forward, what do you hope to do to see in terms of achieving the SDGs, for example? What is Johnson & Johnson's strategy?
Well, I mentioned before that we look at the whole life cycle of a health worker from high school age all the way through leadership and management. Another thing that we look at is technology solutions. As a private sector company, you can imagine there are many technology solutions we think about. One of these is digital health. And one of my favorite examples is Mom Connect in South Africa. We're reaching over 1 million people in South Africa and over 6 million people worldwide with digital health messaging for moms, for both their pregnancy and their newborns. And this messaging is also available and driven by the health worker. What's amazing about this, it's a two-way street. So the health worker gets the information and the government gets the information as well as the mom. And you can imagine if a mom is providing feedback about her health care and she has a long wait, she's going to report that. So I love this digital technology supporting the health worker around the world.
Fantastic, interesting approach. Thank you so much. We have to leave it there. Joy Marini, we appreciate your time today.
Thank you.